Well, hey, Katie, I'm so glad you're here. I've loved having you inside Clinical Academy. So when you said yes to being on the podcast with me, I was so excited because I think you are going to be able to share some amazing insights about how you do clinical practice with all the other practitioners that are listening. So I'm so glad you're here.
Thanks for having me. Happy to be here.
Yep. Well, let's start for those that don't know you. Give me a little bit of a rundown and a background. How did you get into functional medicine? What's your training? What's your story? What's your story of transformation? We all have one, why we chose to do what we do. So, why don't you
Yeah.
start there?
So I was diagnosed with pretty severe scoliosis when I was around 14. I had a 47-degree curve and they
Oh,
wanted
wow.
to do surgery, the whole thing. And thankfully, my parents were much more holistic minded. I started going to a chiropractor and I had major changes. I mean, I didn't know that it was not normal to have a hard time taking a deep breath and my fingers were swollen and all these things. So it truly changed my life. And I went to chiropractic school with the intention of doing more of the structural chiropractic, the real true structural correction. Within my first month of school, I was introduced to nutrition and classical AK, and I knew that was my niche right away.
Yeah.
So I was very blessed to figure that out early because I actually did 300 hours of kinesiology and nutrition while I was still in school.
No
So
way.
yeah, so
Wow.
I came out of school finishing that, and that was really helpful. So I knew a lot of chiropractors I feel like might learn and do their training after. And I mean, I've done a lot since then, but I came out with a lot of that knowledge and knew the direction I wanted. And when I first started, working in kind of, straightforward chiropractic offices, I'd say I marketed myself more as a chiropractor that did nutritional therapy. I wasn't, super confident, but I knew enough. I knew the muscle relationships and
Mhm.
AK, you have a knee problem, let's check your gallbladder, you are having some allergies, Antranex, things like that. And I just kind of slowly built. I really loved it and craved it. I think I went to every seminar that has come through, and whenever there was one offered, I was going to them. I was learning as much as I could, and added in the functional blood chemistry. I've taken that course a few times now. You get something out of it each time you
Every
take
time.
it.
Yeah. Yeah.
I still listen to the audio files. I've got that on my phone. So it's just kind of grown from there. And when I went out on my own, I knew that was the direction I wanted. I wanted to focus on functional medicine. I knew the importance of both of them. Every chiropractic patient is a nutrition patient. So,
Absolutely.
um, I wanted to add that together. And the more I've learned, the more classes I've taken, that just has really grown.
So, what would you say? Let's talk about your niche for a hot minute. How did you land on, or have you landed on, really working? Like you said, when you came out of school, you thought you were just going to do straight up structural work. And then you fell in love with functional medicine, took all the things, got the AK, all of that. But how did you narrow down the type of person that you really want to work with, the person that lights you up?
I think that, once you help one person, they're telling all their friends. So I ended up kind of unintentionally doing a lot of digestive work, upper
Yeah.
gut infections, parasites, things like
Yeah.
that.
Yeah.
Gallbladder. I feel like 'cause so many people have a digestive issue. Who doesn't
Almost
have a
everybody.
digestive
Yeah,
problem?
exactly. It's a
Um,
great niche to have because
mhm,
everybody has either constipated at one end or you're burping and,
yeah.
and refluxing at the other, and then all the
Mhm.
screwed up stuff in the middle.
Yeah. So I think, you get one person, then you get their children, and then you get their husband and their mother. So I kind of just unintentionally,
Yeah.
I do a lot of that. I do a lot of adrenal work because I love that HPA adrenal. I think I took that
Yeah.
course with you years ago, how,
Yeah.
people have adrenal fatigue, but really the hypothalamus and the adaptogens are getting missed. So I do a lot of that work as well.
Yeah.
But I feel like digestion, parasites, you help one person with parasites and then you get everybody who wants
Everybody.
their clear their parasites out. So that was kind of an unintentional thing too. But I
Yeah.
do a lot of digestive repair, liver, gallbladder stuff.
And so describe for me your most favorite patient, the favorite type of person that comes into you.
Um, the one who wants to get better, the one who really, I
Yeah.
mean, it sounds like such a simple thing, but so many people want a quick fix. And, you get that patient who listens to
Yeah.
everything, they take your advice, they're so compliant and they get better. Like I had one today. She's a great patient, but I had a little trouble convincing her to do the 21-day cleanse. And she came in today. She's lost weight. She looked like a different person and she couldn't believe how
Oh,
good she felt. She was like, I want to thank you for encouraging me to do it. I wish, she's like, I would have never done it otherwise. But it was one of those patients where you just feel it kind of, I don't know, revs you up. Like, this is why I do what I do. So,
And I think we all need those once in a while because
oh yeah.
I mean, we all know it's hard. Sometimes it's
Mhm.
hard working with people. People are hard and
Yes.
people are just people and they do people-y things. And sometimes people-y
Mhm.
things are not fun to deal with. And so you get those hard ones. And then the one comes along that's like, thank you so much. You changed
Yeah.
my life. And you're like, yes, this is why I
Yeah.
do what I do. So
Mhm.
I love that. So talk to me a little bit about how you've kind of structured your practice. So when you first opened your brick and mortar, or have you always been virtual or brick and mortar? What do you
No,
do?
I'm brick and mortar. Yeah, I'm
You
brick
are.
and mortar. I do
Yep.
a little bit of the blood work virtually, but everyone, because everyone was pretty much getting adjusted, I was brick
Chiropractic.
and mortar
Yeah.
doing the
Yep.
chiropractic.
Yep.
So, this is one of the things I've learned when I started, when you know the connection with the AK and the muscles and everything, how do you leave anything out? So I was originally doing all of my sessions by time. It was whatever showed up that day. We weren't going to overdo it, but we're going to check what we can. If it's a knee problem, we'll check your knee muscles, we'll adjust you, but we'll also check your gallbladder and things like
Yep.
that.
Yep.
And I quickly realized that that was a problem because the list of what people want to have checked gets longer and longer and your time is limited. And
Yep.
so I ended up separating appointments a little bit. They could come in just for an adjustment, because what I realized is I'd have these patients and I'd say, hey, I think your neck pain might be inflammation or blood sugar. Do you want to check that out? And they, of course, they're going to tell you to your face, yeah, let's do it. And I'd put them on some supplements, and they wouldn't take them or they wouldn't come back. And I thought, this is really strange. Like, they said they wanted to do it. Don't they want to get better?
Yeah.
And I started offering an adjustment only visit. So you don't have to, you don't want to do any muscle testing. You don't want to do any AK stuff. That's fine. Just come in for an adjustment. And a lot of people chose that. And it was very eye opening to see that, they were telling me they wanted to do nutrition and
Uh-huh.
deeper healing.
Uh-huh.
They had no desire to.
Yeah. Yeah.
So having that was kind of the first thing that I changed, was offering for people to do a little bit less. And just recently, I've realized that doing chiropractic and nutrition together is just very difficult. And I've started separating those appointments. That was the pebble in my shoe.
Yeah.
Walking was just, every day I was leaving there so tired. And I'm thinking, I've been doing this for 12 years, but I can't imagine doing it for another 12, because I'm that tired at the end of the day. I got
Yeah.
to change something.
Yeah.
And I was honestly ready to give chiropractic up. I thought, maybe I'll just do nutrition. I'm tired. My body's tired.
Oh,
Yeah, but then I couldn't do that because I love it. So
I
I
know,
thought, what
right?
do I do to, what's the solution to separating and, or to making a change? And that was separating the nutrition from the chiropractic. So I'm in the middle of doing that now. People are just switching over, actually starting on Friday. No one will be able to do both. March 1st was kind of like our cutoff date. We started switching people over a month or two ago. And that's
So
helped tremendously already.
So you basically, your original model, which so many practitioners get caught
Mhm.
in, whether you're an acupuncturist, when you have a hands-on discipline, right? You've got the patient, they're a captive in your treatment room, right? And it happens all the time. And they start asking questions. Well, could you just muscle test me real quick for this? Or here, I brought in 4 supplements. Can you tell me what you think about these nutrients? Or, well, what should I be taking for this or that? And it gets all convoluted. And then what happens is the patient leaves, they didn't get the best version of you, right? Because you can do
Yeah.
the adjustment, but you're not giving them their best service as far as helping them resolve the health issue. But it's a trap that everybody gets into. And it's a
Mhm.
slippery slope.
Yeah, I thought I would never be like that. I had other practitioners warn me, don't do this. I thought, no, I can handle it. I can manage it. But it just starts snowballing. And before you know it, it's like, oh my gosh, what do you do? And it became normal to be stressed out and running on adrenaline all day. And I didn't
Yeah.
even
Yeah.
realize that I was that stressed. But it's been good so far. And I just tell the patient, listen, I can't do both well in that amount of time. Something's going to get missed. I either do my nutrition testing or I do the chiropractic. And, we can't squeeze in both, because that's not beneficial for you, number one. But number two, it's a lot for me to try to fit in. And, most people have been very receptive. There've been a few that haven't been okay with it.
Mm.
But
And
when
what'd
they've
you do
come
with those
back,
people?
Well, I said, well, this is just the way it is, you know, this, I have a great assistant and she just tells them like, well, this is
Yay.
how she's doing it. And, she'll even say, you know, if you want her to be around for a few more years, this is how we're doing it. Like, oh yeah, of course we understand. And,
We understand. Yeah. Yeah.
but
Yeah.
we did have a couple that did not, they weren't very receptive, but when they came in for their separate appointments, they actually said to me, I understand why you're doing this now, because those things were never getting checked beforehand.
Yeah.
And, you know, they were actually very grateful because, you know, one of them had a knee issue and she said, you know, I never told you about it because we never had time. And, you know, we did one session of
Yeah.
some AK work to her knee and her knee pain was gone. And she said, I wish you know, I should have told you earlier, but there was no time. We were working on her gut.
Yeah.
So
Yep.
now she's
Yep.
like,
Yep.
I understand why you're doing it this way. It benefited her more than anyone. And, you know, it makes me feel bad. I'm like, we could have fixed that months ago,
I know.
you
I
know,
know.
but we're learning.
Well, this is so fascinating. And I think it ties back, Katie, to the conversation about knowing your niche, knowing what you
Mhm,
do and what you do well. But there's such different languages. Chiropractic
mhm.
is a language in and of itself. When your
Yeah.
hands are on the body, you're doing something completely unique and different than you are, even the way that the brain is processing information, right? It's just
Mhm.
completely
Yeah.
different. It's like speaking one language and then you're over here speaking this functional medicine language. And although both of them are both rooted in Latin, let's say, they're
Mhm.
just both completely different languages. So understanding that they, irrespective of each other, they're actually kind of their own little niche.
Yeah. They
Really.
really are.
Hmm.
And that's the thing when you know that they are related, when you know chiropractic cases are nutrition cases, I think part of it was being honest with myself that it was okay to not try to do everything. Like there's this
Yeah.
pressure that we're supposed
Yeah.
to do it. And it's like, no,
Yeah.
I can't do that. And that's okay. But you know, the more you're with a patient, they come in and they have, you know, they're constipated, their allergies are flared, their knee hurts, their neck hurts. And it's like, okay, well,
Exactly.
now it's on me to pick and choose. And that's a lot of pressure. And I don't want them disappointed, but you know, it's perfectly okay to focus on one thing and really help them. That's just,
And
you know,
And by focusing on that one thing, you're serving them much better. Just like
yeah.
your knee lady, right? You then have
Mhm.
more time to get through your assessment with the patient rather than
Mhm.
trying to cram it all in. You're not doing a good job for them. So let's talk about that conversation that day that we had where we were talking about the pebble in your shoe.
Yeah, it seems so, you know, obvious now, but when we sat down to speak about, you know, we did the consult for the business, you asked me what's the pebble in the shoe, what bothers you the most. If you're walking, it's just irritating you. And it
Mhm.
was trying to do too many things and leaving there exhausted and overworked. And it's kind of like, well, I don't have to do that. And it seems so obvious now, but at the time,
You can take the
you
pebble
know,
out of your shoe anytime you
yeah.
want. Yeah.
But I think we're in this profession because we want to help people. So backing off and not feeling like I'm going 100 miles an hour, it felt like maybe I wasn't helping them. And I think I needed to, you know, step back and say, it's okay if I'm not, you know, super stressed all the time. I can get a
Yeah.
slower pace and I can still help people. I can still take the pebble out of my shoe. They're probably going to get better care because I'm not tired and
Correct.
I can focus
Correct.
on things. But it was almost like I needed to hear it from someone like, yeah, that you don't have to work like that every day. And
Like
it
you
made a
needed
huge difference.
permission to
Yeah,
pull the
yeah.
rock out of your shoe. Like, I'm like, okay,
Hmm.
here's your permission slip. You
Hmm.
do that. What was the biggest fear for you in doing that and removing that thing that was irritating you, which is trying to do both, trying to mix visits, combine visits, and not feeling like you were giving good enough care or the right type of care, and being completely wiped out and exhausted at the end of the day. So when you realized that you needed to make a change, what was the fear behind that? Because there always is some apprehension like,
Yeah.
what if?
Yeah, it was definitely patient reaction, because I didn't want people to think that, you know, I'm separating it to make more money and I'm doing this because I don't, it wasn't that at all. But, you know, I knew there was going to be some people who weren't happy, and that was definitely the case. But when I started separating patients and noticing the difference and noticing how less stressed I felt and how much, I mean, I felt so much better that I thought
Yeah,
this is worth it. I kind of got to the point where
yeah,
I was like, they can be mad. I'm okay with it because I know that this is the best thing for me. It's the best thing for the patient. They're going to get better care. And I think I also had to just be confident in telling them that, you know, if they come in and we're doing chiropractic, it's okay to say to them, you know what, I don't have time to do that today, but why don't you get on my schedule for a nutrition check, and we'll make sure we have the proper time to give you the attention it deserves. And
I love that.
that's all you can say to them, and no one can be mad when you say that, but it's that unknown. I've done things for the same way for so long, and people are used to coming to me and throwing everything at me.
Yeah.
So I didn't want them to think it was me not caring or me trying to do less. It wasn't that at all.
So what do you think made the biggest change in the way that you felt at the end of the day? You're still, really, if you look at it, you're still doing the same work, still
Mm-hmm.
doing the same things. In fact, you're probably doing more work chiropractically
Mm-hmm.
than you were
Yeah.
before, right?
Yeah.
And
Mm-hmm.
you're doing the same type of functional consult. So why do you feel better now? Yet, if you look at it, you're still doing the same thing. What do you
Mm-hmm.
think helped your body be able to respond differently?
I think it's the expectation. When they come in, I know what we're doing. When someone would come in for a joint appointment, I don't know, is this going to be more of a chiropractic thing today, or they're going to come in and they, had food poisoning over the, what's going to happen, but I'm still expected to fit everything in. When they're on my schedule for nutrition, I know what we're doing. I know what I have the time for. I know what I can get done in 15 to 20 minutes. But if I have to do multiple things, then I start to get a little bit like, okay, how am I going to do? How does this connect?
Yeah.
Okay, what do I do first? So you're mentally, intellect, like my brain was tired. When I
Mm.
know what they're coming in with, and I know how many muscles I can check in what amount of time. I know how long an adjustment takes. When I know what's coming in the door, I can manage the time better. Their expectations and mine are about the same, and it's just much easier.
And they really are getting the best version of you.
Mm-hmm.
They're getting
Yeah.
the very best version of you, the version of you or any practitioner that's mentally taxed, exhausted, tired, you're not sure what's going to walk through the door. I love that you made that clarification and distinction for yourself that you didn't know. Are they coming in for, they're on your point books, but what are they coming in for? Is it straight
Mm-hmm.
chiropractic? Are you doing functional? Like, is it a hybrid? What are you doing? And it is exhausting. It is exhausting. So has your productivity changed at all?
Yeah, I feel like I could see more people in a day. I mean, I remember telling you on the phone, like, is there something wrong with me? Like, I feel like at 5 or 6 hours, I am done. Like, I can go
Uh-huh.
home and do blood work and I can do that. But it's like the interacting and the talking and the thinking,
Yep,
that was
yep.
I knew what my max time was, but I feel like I could do more now. Just because there's not, again, the expectation, if someone calls and they're like, hey, my back's hurting, can you fit me in? Yeah, I can handle that. But if they just call to get in and they want their back checked and their allergies, and that's I don't have time for that in that amount of
Yeah.
time.
And don't you just find like even saying it, I don't know if you can feel it, but I can just feel that. Like you even saying that, like if you want to come in and I'm going to fix your back, great. There's such clear energy with that.
Yeah.
But
Mm-hmm.
then you even mumbling those whole words together right there in that
Yeah.
sentence, you can feel
That's
the
what it feels in my head. Yeah.
yes, yes, you can feel the chaos of the whole thing
Mm-hmm.
even as you say the words. So how many practitioners out there that a lot of people struggle. I mean, I said that like they just struggle knowing how to separate. It's a common question that I get. It's like, well, how do I do it? Well, this is how you do it. You just separate it out. So do you do chiropractic only on certain days? Do you functional medicine on certain days? How do you
I
do that?
don't. I don't. I've heard a lot of people say that's the best thing to do, but I feel, I have some patients that only have Fridays off, or I have several patients that travel all over Florida to see me, and I don't, if they're there, I don't want to, say, oh, you can't do an adjustment today because it's Tuesday and this is my
Yeah.
nutrition day. So I
Yeah.
don't like to do that. And I'll be honest with you, I kind of like, if I've had a busy morning doing blood work and all the nutrition, a chiropractic is an easy break.
Is
My
easy.
brain is like, okay, we're gonna adjust. That's
Easy.
easy. I
Yeah.
kind of like the breakup of the day. So I
Yeah.
don't separate the days. But my assistant is very good. She knows how many, we only do one nutrition exam a day. I don't do a bunch of, because that's a longer appointment.
Yep. Yep.
So we limit it to one a day so that we can fit in adjustments and fit in follow-ups and things like that. So she's very good with my schedule. She knows, she's very good at kind of evening it out. So it's not all one thing or one or
So
the other.
hard. And that's such a good point too. And that is that you really, when you're busy like this, you really need somebody who's watching your back
Oh yeah.
because she's like air traffic control for you.
Mm-hmm.
She's telling when's a plane landing, when's a plane taking off, who's taxiing, who's sitting out on the tarmac, who's waiting to come in, what's happening with the gates. like she's running air traffic control for you. And then so
Yeah.
she's really managing your flow of energy throughout the day as well.
Yes. Yeah.
Yeah.
That's very important to have someone who understands that for sure.
Yeah.
Yeah.
So how do you handle, what do you do with follow-ups? I'm just curious, like how often are your follow-ups with functional medicine and then with I guess chiropractic is going to vary based on the person, but how does your
Yeah.
front desk person, what do you like? And then how do you manage that follow-up at the front desk?
So their first appointment is longer. I do about an hour because I go over their blood work with them, do the consultation, and then I do the muscle testing. I'm also doing nutrition, like the zinc taste test and the calcium cuff test. I like people to have that, the
Yep.
objective
Yep.
that they can measure.
Yep.
So I'm doing a lot in the first visit, and about, 30 days later, 4 to 6 weeks, somewhere, like depends on the patient, but probably 30 days is average. They'll come back and it's a 20-minute follow-up. I already know what points I'm checking. I already know what I'm looking for. I can scan it quickly, and we adjust their supplements based off their symptoms. Redo the calcium cuff, redo the zinc, all those Raglan, stuff like that, and come back in another 30 days. Occasionally, like I had a patient today, she had a lot going on, and I said, I want to see you in 3 weeks. I want to make sure there's something changing. I don't want to wait that long. So it's
Yeah.
really
Yeah.
person dependent, but for the most part, I say I give it about 30 days to before I want to look for a change.
So, I was thinking as you were talking, I was thinking about how your niche, we'll call it, is just that you end up just working with all these digestive cases. Can you imagine what it would be like if as a function on the functional side, because you said, the chiropractic's easy. You could almost do it with your eyes closed, right? So easy. But on the functional medicine side, without having a predetermined lane to be in other words, your lane is kind of digestion. That's not to say you get a once in a while an outlier, but primarily your lane is digestive issues. Can you imagine what that would be like if you went from one patient who's a Lyme patient, the next patient's a fertility patient, the next patient is a RA patient, the next patient is a gut patient, the next patient is a brain inflammation patient, the next one is an Alzheimer's patient, the next one is another hormone patient. Talk about
Yeah.
cerebral stress. I mean,
Yeah.
and that's often what happens when we try and help everyone.
Yes.
It's
Yeah.
exhausting. It's exhausting because you
Mhm.
can't ever spend the time to just be really good at one thing. You just be really good at that one thing. And I love that you've just kind of, by hook or crook, you just kind of found your spot and you're like, oh, this is my zone. This is my lane. And I'm going to just keep doing
Mhm.
this thing. And so, how do you handle it? Do you say no to cases that are not digestive related? Or do you take everyone, but you just know that your reputation or what you're known for is more digestive cases?
Well, the other thing that we added into the practice was they have to apply to be a patient in the practice. So I made a
Ooh,
form incognito.
saucy.
Yeah. I never thought I would do that, but as things change and your practice is growing,
Yeah,
it's been
yeah,
really helpful. So we have a link on the website, apply to be a patient. And if they call, my assistant knows she'll ask those same questions and type it in.
yeah,
Are you already working with somebody? Well, if you are, why are you coming here? We want to, you don't want too many cooks in the kitchen.
exactly.
Are you willing to make changes? Are you willing to take supplements? There's some questions like that. And then of course, what is your concern? So I will take other cases, but it does depend, every once in a while, like if I get an active Lyme disease, that's not my area. That's very, very complex. I
Yeah.
might refer that out, but I do feel like I don't do any marketing. It's all internal referral. So I do feel like I get a lot, of the similar type cases,
Yeah. Yeah.
kids who are, having issues with their gut. So I've never I mean, very rarely will I not take somebody, but you end up getting a lot of the same types of symptoms anyway.
Yep, yep, yep. I do love that. I love the, being able to apply, have someone apply because it really does help you find that good fit. Because when you do have somebody that there's two cooks in the kitchen, or they say, oh, I've been everywhere. This is my favorite. I've
Yeah.
been to everyone and no one can help me. And they just, oh, you're my
Yeah.
last hope. Like, yeah, let's keep looking. Let's keep looking for somebody because those are
Yeah.
never ever going to be good fits ever. So,
No.
yeah,
Or even
having
just
that,
the supplements, like not every patient. I had a couple of patients. One of my questions is, are you vegan or vegetarian? Because not everyone wants to do standard process or
yep,
doctor's research with the
yep,
glandulars.
yep, yep.
And, when we've told them that up front, they're very, they're actually very thankful that we told them that, don't spend the money and come to see me, then you're not going to take anything.
Right.
Um,
Right.
so, just even little things like that can make a big difference.
And what it does, and you've seen this, but it elevates your credibility and your
Hmm.
trust, because
Yeah.
people then know that they are safe with you, in that you're going to be honest with them. Because
Hmm.
there's so many shystery people out there doing this
Yeah.
work. There's a
Yeah.
lot of them, just like there's, we'll refer to in general as like snake oil salesmen. They promise the world and then they don't get results. So when you do deliver the results and you know how to get a good outcome for the patient, then when you are really clear about your boundaries, people respect that. I mean,
Yeah.
even just in human beings, I really respect someone who says what they need. I need this. This is how it is to work with me. I'm like, okay, well, that works for me or it doesn't work for me, but thank you for being clear. So it just
Yeah.
elevates you in the community with the people that refer to you. They're like, she's going to shoot straight with you. You don't have to ever worry about it. And it really positions you as being the authority. And it sounds like you've done a great job in your area. So are most of your people local, or do they drive from out of?
They are, but I do have a lot that drive. The mother lives here and the brother lives here. So I think, I have people that come up from the Keys to see me, and that's a good 6 to 8 hour
It's a
drive.
long drive. Yeah.
Um, yeah, so I have a lot all over Florida, but a lot of them are local. You get in with one of the moms and then all the mom, so I see a lot of the kids at
Yeah.
the
Yeah.
healthy school in the area. A lot of the kids come to me. So yeah, you end up seeing a lot of I see the holistic group in my area for sure.
Yeah, 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 yeah. Well, that is just so, I love that. And then before we wrap, I just want to touch on one more thing. You mentioned when you and I were on the phone, you kind of talked about how your practice just was so busy that you were thinking you might want to add somebody. You weren't sure if you were going to add somebody, like you were kind of tossing that conversation around. Um, I love that you kind of got really clear about getting the rock out of your shoe first. Not that hiring someone is a wrong thing to do or a right thing to do, because it's different for every single person.
Hmm.
But very often, sometimes practitioners will say, oh, well, I'm going to just, I'm not doing well in my business, so I'm going to bring somebody else in. And I
Yeah.
see this often. It's like a Band-Aid. Oh, well, I don't
Hmm.
know how to do it, but if I bring someone else in, then maybe they're going to help me. But really, for you, whether you decide to hire somebody or not is irrelevant. But the bigger point was that you figured out what was not working,
Right.
fixed that problem. And now, if you were going to have that conversation, or do you feel like you're in a position to hire somebody? What would you say now? Like, is it on the radar,
Yeah.
off the radar for you? Like, what would you say?
It's really, it's interesting. I hadn't really thought of it. It's not really on the radar right now because I think bringing someone in could have taken some of maybe the chiropractic stress off and seen people, but I still would have been doing double the protocols per visit and I still would have been exhausted. I still would
Yeah.
have been burned out
Yeah.
and so it would not have fixed the problem. So now I'm in a place where I leave the office not feeling so drained and I feel like I could see more people. So
Yeah.
at this point, I feel like I'm in a good place. And putting up those boundaries, you had said to me, when you have a wait list that's so long and you're clogging the pipe, that's not good either. So I
Right.
did raise my prices a bit. We've changed the
Yay.
protocols, changed the structure, and I feel like I can get people in sooner. I can get them in more. So yeah, I feel like I'm in a good place now. I'm excited to see where the next year takes me because I already can tell we haven't, most people are switched over, but officially it starts on Friday and I already feel so much better.
Oh,
Um,
I'm so
so I'm
glad.
very excited to see how it goes.
I'm so glad. Well, Katie, it has just been such a pleasure to chat with you. I knew you were going to give us tons of little good tips and nuggets. So thank you so much. It's just been my pleasure to have you on the podcast.
Well, thanks for having me. Love
And
chatting with you.
where can people connect with you?
I am on Instagram at dr.katiemalley, Malley. And I don't use Facebook as much. I feel like they get a little bit more censored. So I
Yeah.
have, I never really used to use Instagram until the last few years, but I try to post on it. And actually, I feel like I wasn't very good with posting things, but now that I feel like I have a little time freed up, a little bit,
Oh,
I
look at
feel like
that.
that's my plan
Mm,
is to go more into like the education and my posts and stuff like that, maybe do some virtual health classes for patients. So that's
yeah.
kind of what I'm looking at, but that's probably what I'm the most active on is Instagram.
Instagram. Okay. Dr. Dot
Katie
Kate
Malley.
Malley on
Mhm.
Instagram. And what's your website?
Pathways to healthflorida.com. So pathways, the number two, healthfl.com.
Nice. All right. Well, now we know where to go stalk you. Thanks, Katie. Thank
Thank
you.
you.